Hello everyone, my name is Robin McDonald Cobb. I'm a 4th grade teacher at West Forest Intermediate School in Opelika, Alabama, and this is my diversity presentation on specific language impairment. Before I begin discussing specific language impairment, I just want to talk about some language development theories as they relate to cognitive development. According to Ormrod, cognitive development is essential for the development of language. Children can talk only about things that they can in some way first think about. Piaget says, language provides a set entity through which human beings can mentally represent external events and eternal schemes. Vygotsky says, thought and language are separate functions for infants and young toddlers. Thinking occurs independently of language, and when language appears, it is used primarily as a means of communication. So what is specific language impairment? Specific language impairment is often referred to as SLI, developmental language disorder, language delay, or developmental dysphasia. SLI is a communication disorder that interferes with the development of language skills in children who have no hearing loss or intellectual disabilities. And SLI can affect a child's speaking, listening, reading, and writing. Here I have a question to self. Have you ever come across someone with SLI? Causes of SLI. According to research, there have been several internal and external factors that contribute to a child's development of SLI. The most common internal factor is genetics. Recent discoveries suggest that there is a strong genetic link with parents and/or siblings that have difficulty and delays in speaking. The most common external factors assumed are poor parenting, subtle brain damage around the time of birth, and transient hearing loss. Symptoms of SLI. I have 2 sections here. The first is for preschool-aged children, and the second is for older. The following symptoms below are typically indicated in preschool-aged children: late to put words together into sentences, struggle to learn new words and make conversation, difficulty following directions, and frequent grammatical errors when speaking. The following symptoms below are typically indicated in older children and adults: limited use of complex sentences, difficulty finding the right words, difficulty understanding figurative language, reading problems, disorganized storytelling and writing, and frequent grammatical and spelling errors. SLI diagnosis. If a child is suspected to have SLI, they can be recommended to a speech-language pathologist who will evaluate the child's language skills. The evaluation includes the following: direct observation of the child, interviews and questionnaires completed by parents and/or teachers, assessments of the child's learning ability, and standardized tests of current language performance. These 2 photographs on the right indicate a speech pathologist working with a younger child and a speech pathologist working with a child that is much older. SLI, a risk factor for learning disabilities. SLI is not the same thing as a learning disability. However, it is considered to be a risk factor. SLI influences basic language skills, which affect classroom performance. Children with SLI are more likely to be diagnosed with a learning disability than children who do not have SLI. Issues that children will face in a class setting are translating letters into sounds for reading. Writing skills may be weakened by grammatical errors, limited vocabulary, and problems with comprehension and organizing thoughts into coherent sentences, and difficulties with language comprehension, which can make mathematical word problems challenging. SLI treatments. Treatment for SLI are provided by or recommended from a licensed speech-language pathologist. Treatment may be provided in homes, schools, university programs for speech-language pathology, private clinics, or outpatient hospital settings. Here are 3 sections below. Treatment for younger children can be as follows: acquire missing elements of grammar, expand their understanding and use of words, and develop social communication skills. Treatment for school-aged children can be as follows: following directions, understanding the meaning of the words that teachers use, organizing information, and improving speaking, reading, and writing skills. And lastly, treatment for adults can be as follows: help learning technical vocabulary and improving workplace writing skills. Here is an infographic of the scope of the speech-language pathologist. Here's another infographic of childhood speech and hearing disorders. This has a few statistics about speech and hearing disorders. The last infographic that I shared also talks about speech and language and hearing, and it has a few statistics as well. One thing that I noted from it is that it says 8 to 9% of young children suffer from speech sound disorders. This is the second most common reason for special education services in public schools, and it contributes to speech language impairment. Instructional strategies for children with SLI. There are several different strategies that can be used to help children with SLI. Here are a few that can be used in a classroom that will help accommodate students with SLI. 1. Be near the student when giving instructions and ask the student to repeat the instructions and prompt when necessary. 2. Allow students to tape lectures. 3. Modify classroom activities so they may be less difficult but have the same learning objectives. 4. Allow extra time to complete work because of distractions, slow handwriting, or problems in decoding text. 5. Use a visual reminder of the day's events to help with organization. 6. Use gestures that support understanding. And 7. Use storybook sharing in which a story is read to student and responses are elicited. Praise is given for appropriate comments about the content. I've also included a link that has several and various more different tactics that you can use in the classroom to help with children with SLI. Here's my references. Hopefully you have learned some valuable and important information about SLI. Please feel free to leave a comment, question, or concern down below my discussion post. Thank you.